Welcome everyone to our newest episode of Smile This is in the Air, or your oral health and prevention podcast. I'm Celso da Costa, and today with me I have Dr. Nia Dixie. Dr. Nia Dixie, the global lead of clinical affairs and professional education at EMS. She is a member from STA and EMS since 2009.
That's correct.
She is a periodontist by training, but really believes in the prevention and education that she can bring to the professionals and always back it up with scientific evidence. Most important, I can say that she's maybe my most important friend.
Thank you.
A true friend. And she's my right arm also at the STA. So welcome, Neha. How are you?
Thank you, Celso. Doing very well.
Okay, this is the part that you were nervous and you didn't know how to handle it. But don't be nervous. You are a pro, you know this. And the first question, just to start in this podcast with the right foot, is you were and you still are part of this revolution, a revolution that is centered on prevention, or better, that wants to center dentistry through prevention. So how do you feel about it?
I feel good because I wish this existed about 20 years ago. Then I would not have gone through what I did. And I think for everybody today, your family, your friends, I think dentistry, definitely if you need it, but prevention is the key. So we didn't have it back then, but now we do have methods. So I think yes.
And it was that pushed you to come to EMS, because 2009, it's a long time ago.
Exactly. Till 2009, I was only doing surgical work. And then when I discovered the need, I would say not really discovered, but I think the emphasis, the focus on you could really save teeth because they're free. That's the problem. They're free. So we don't look after them. And I think when you go through it yourself, your family, you really realize that, yes.
You have the funny story that when you came to EMS, you didn't know what was an air polisher.
I did not know anything. We heard about it in India because it was only used to remove stains. We knew an air polisher. We only knew one type of powder in India, but it was only for aesthetic reasons. That's about it.
Okay. And how was the STA in the beginning? Because the Swiss Dental Academy actually didn't have the potential that it has today. They had the backup with the scientific evidence at the time. We're talking about 2009 when you integrated the team. And there wasn't guided biofilm therapy.
No.
So what were you doing?
That's a very good question. This actually is a very historical background because when I joined EMS, I was just told to start with an SDA training. I was introduced, I was shown what an airflow was, and I had the first group in front of me to talk about it. So it was a learning as well for me at that time. And it was all new. And I think every day I'm still learning. And now thanks to guided biofilm therapy, of course, we've changed the way we look at things completely in a more logical way. So yes.
So it was like head first.
I do not want to talk about it. Maybe for another episode. If I describe my first SDA training in Neo, it's memorable.
Yeah, it was a good thing. Like there was a good progress since then. So.
Yes, absolutely.
But fast forward on the history, because then 2017 there was something that changed, that guided biofilm therapy was created and showed to the world, and you were part of this. So you're part of the history of EMS also.
Yes.
And how was this? How was the first draft, the first compass developed, and why?
So actually what happened is we were in touch with a lot of universities, a lot of clinicians and people from the academic field. They approached us and said that we really need to change the way prophylaxis is looked at today. Because we know that last 50 years, there's been no change in the way we approach prophylaxis. So it was just about prophylaxis and cleaning teeth. So we really needed to change that entire mindset. And to change it, we needed something more systematic, something more logical, more modular system. And of course, nothing is going to work unless it's backed by scientific evidence. So we put together these 8 steps. Really, again, it's modular, but it just was so much more logical. So we worked with university clinicians, professors, academicians, and we put together this. So EMS really helped them with respect to the technology, but it was all backed by scientific evidence. So it took time, but it's a step, so it's slow and steady. But I think this is the only way forward today.
That's the thing.
It's so simple.
Sometimes we think this came up out of the blue, but it's not that. That was work done before, and it was also the compiling of the experience of different clinicians and different educational institutions. So, but again, why? Why do you need it?
Because imagine how it was done in the past. It's a shameful thing. We've all scratched teeth. We've all done very unethical work in the past. I really wish we had this simple system, this simple protocol to follow. World would have been different. And I think slowly it is improving. Prevention is the only key forward. I think that's the only thing forward.
And what was the first impressions? We know that everything that is new, and when we are talking about universities, if it's new, it takes time to get in. How was it perceived? What was the impact, the feedback?
Nobody wants to change. Of course, it's like you're getting fantastic results with something today. Why do you want to change? So definitely, even till today, we have a lot of resistance from universities, because this is not something that exists. GBT does not exist in textbooks today, but it will in the future. So it's going to take time. We have to change mindsets. And again, everything that we are talking about today is backed by scientific evidence. It is really simple and logical. But I would not really say it, but yes, definitely we have some very strong personalities which are extremely resistant because they do not want to leave their old school of thinking, old theories, older concepts, and yes.
But the beauty of the thing, and this is what I like when I visit universities, we have these ones that they implemented this new way of doing prophylaxis into their curriculum, and they give the choice to the students. And I think that's important, is to know multiple ways of doing the work and having really good results. And then let the future clinicians decide. Let's see what's going to be more beneficial for their future, also as a clinician and as a person, because we need to take care of our body. We talk about this in one of the episodes. To keep doing the work as a dental hygienist, a dentist, dental professional in general.
I completely agree. You have to expose students to all different technologies available today, because there's nothing right or wrong. It's about what you feel good, whether it's your ergonomics, whether it's the patient experience or your experience, or just simplicity in doing things, the time factor. Let the students experience everything. Let them decide. Completely agree. So I would never put down the older technology. They need to understand what was done in the past and what other professionals have been doing for so long. And then let them see it from themselves, experience it actually, not just see it.
And now, we are talking about 2017, and now, how it is it? How you see GBT? Did it integrate it well? Did people ask for it? People look for it?
Yes, patients are much smarter now. I would say, I think the need of GBT is going to be coming from the patients now, because with social media, you see the awareness on oral health, on prevention, on systemic health. So definitely everybody wants to preserve what they have today, and instead of spending money on something artificial. So I think patients are going to be the ones really taking this forward.
Yeah. Taking another route here. You really like to teach.
Yes.
I must say this, because every single time that you are in front of an audience teaching something, you are smiling. If you are in front of a computer, you get tired. But in front of an audience, you really smile and you really shine.
Because I believe in what I teach. it's not that I believed in air polishing in 2009. I did not believe in it because I had never experienced it. So it took me some time, but now, last 13 years, I believe in what I do, and I completely talk with my own conviction, my own experience. And I will make sure I drill it into anybody's head because
And
it's a
I
fact.
think it says a lot that it's been 13 years, but always with the same motivation or even more. An interesting part is like everyone that got a training from you know you quite well, and they have this close contact, and they want to be trained again by you the second and third time. So how do you feel about this loyalty too? Because is it loyalty towards you?
I love it because I know that there's so much more I can keep offering because it's not, I'm also learning every day. So sharing my own experiences with people, you talk about weaknesses, strengths, overcoming them. So I think it's great.
Yeah.
I love to share ideas.
Share ideas, but also bring other people with you on board.
Absolutely.
Yeah.
Absolutely.
And
It's a revolution. We need to join.
And I will never forget one thing that it was in the COVID period that we were working quite closely. And one time we were in the car and you asked, Celsius, don't you want to join 100% EMS? So I already did.
I remember that.
You were the first person that I told I was joining EMS. And since then, I think I think it was the best choice, but it was a choice based also on you. It's knowing that I had people like you working with me. So that's a really good point. Don't start crying.
There's so much to learn from you. You're a workaholic.
No. Well, I can say the same thing about you.
I love what I do.
Yeah,
Otherwise, I wouldn't.
That's the thing. It became a hobby.
Yeah.
And if it gets into a hobby, it's kind of healthy. I'm not going to say otherwise. But the thing is, we need inspiring people, and we need people with the emotions. You're going to be the first one that, if someone is like just asking questions with a negative connection,
I will jump in.
That's the thing.
No, I will jump in because it's true. So it's sometimes, yes, we do encounter professionals where you have to bang yourself against a wall. But when we have nothing to hide, we are absolutely ethical. So why should we not be loud about it?
Yeah.
So.
And the clinical affairs from your side and the clinical evidence is super important. You are doing a really good job on it, and it's been a while. What is the difference that you see now in the articles? They are more centered on prevention, less the same, or you don't see really a change in the mentality of the people, or in this case of the clinicians that are practicing in the next 5 years?
I think in the last, the terminology GBT came into existence in 2016. So it's the last 6 years we've seen a lot of actually university researchers have approached us proactively. They want to understand the system better. They want to understand the technology better. So there is definitely a change. It's coming. It's going to take time. But I see a lot of difference now in thinking. But again, it's about really explaining it to them and not just going ahead and saying, this is what we have, this is the best. No, they have to know it and understand it and experience it.
Yeah, experience by itself.
Absolutely.
Yeah. Nia, this was really a great pleasure to talk with you. We learned about a little bit of your history, how it starts with GBT, how important is the professional education for you too, and also the clinical and scientific evidence. And well, if the listeners want to know more about it and see how GBT can be implemented, they can always download now the 100 GBT clinical cases or from the website too. So thank you so much for coming.
Thank you very much.
And for the listeners, don't forget to subscribe in any platform that you are listening or seeing this podcast. And see you next time.
Thank you.
Bye.
Bye-bye.